How are you today?
I'm fine, thank you.
We're used to relentlessly good news on the vaccine programme as people stream into centres like this in Reading. More came today as it emerged that 9 in 10 70-year-olds now have coronavirus antibodies. The Health Secretary was bullish.
We have now vaccinated over 25 million people across the United Kingdom. The vaccine is saving thousands of lives right now here in the UK, and it can give us all hope.
Emphasising the positives, of which there are plenty, but sidestepping significant bad news. Just moments before he spoke, this letter from NHS England revealed there will be a significant reduction in weekly supply available from manufacturers beginning in the week commencing the 29th of March, meaning volumes for first doses will be significantly constrained. Meaning that inviting patients outside of cohorts 1 to 9 is only permissible in exceptional circumstances. Those aged 49 years or younger should not be offered vaccination unless they are eligible via a higher cohort. They go on to say that no further appointments should be made between the 1st to the 30th of April. The Health Secretary, though, seemed dismissive.
Supply is always lumpy, and of course, these supply schedules have moved up and down throughout this whole rollout. It's absolutely par for the course, and it is that's why it's that is a normal operational letter. We're committed to all adults being able to get the jab by the end of July. And we're on track to deliver on that commitment.
The government's commitments were always ones they knew they could meet. Today's announcement still matters, though, says the opposition.
It's clearly very worrying. It's quite significant that vaccination appointments will have to be paused for a whole month. Nobody was expecting an issue of this scale, not least because Boris Johnson keeps boasting about his vaccination programme. Well, people tonight deserve clarity and an explanation from ministers.
Those very ministers are acting as if they think that people won't notice the vaccine slowdown because the rollout has gone so well generally to date. But people are obsessed with when they're going to get the jab, and telling all under 50s that now won't happen until May will rankle. Downplaying or even ignoring bad news is something some people think Matt Hancock and his department have form for.
Do you feel like there's more that could have been done?
That criticism came earlier in the day from Boris Johnson's right-hand man until November, Dominic Cummings, who admitted big flaws in the pandemic response and pointed the finger of blame.
In spring 2020, you had a situation where the Department for Health was just a smoking ruin in terms of procurement and PPE and all of that. It's not coincidental that the vaccine programme worked the way that it did. It's not coincidental that to do that, we had to take it out of the Department of Health.
The people in here don't want to dwell on the mishaps of last year, but could today's announcement be more than a bump in the road? Sam Coates, Sky News.